Immunoglobulin G, IgG therapy, is widely used as replacement therapy and as immune modulatory treatment in a variety of immune-related diseases. IgG, the body's most abundant antibody, is pooled from thousands of healthy donors, purified, stabilized, and delivered to patients to effectively and safely treat immunodeficiency and some autoimmune disorders, such as immune thrombocytopenic purpura, ITP, and more recently, chronic inflammatory demyelinating polyneuropathy, CIDP, and dermatomyositis, DM. CIDP and DM are both autoinflammatory immune-mediated disorders where autoreactive cells of the immune system attack tissues, causing inflammation and damage. CIDP affects the peripheral nerves, while in DM, primarily small blood vessels in the skin and muscles are targeted by the immune system. Both conditions cause chronic symptoms that often require long-term treatment. IgG therapy offers a broad-spectrum approach that modulates multiple aspects of the immune system by neutralizing and reducing pathogenic autoantibodies and pro-inflammatory cells. IgG therapy accelerates the degradation of autoantibodies by binding to neonatal Fc receptors, FcRn, which are highly expressed on vascular endothelial cells and other cells. FcRn binds circulating IgG and protects them from degradation. During IgG therapy, supraphysiological IgG levels saturate FcRns, preventing pathogenic antibodies from binding and thus from being recycled, leading to their degradation in the lysosome. IgG therapy also inhibits the complement system, preventing the formation of the membrane attack complex, MAC, by binding to and promoting the degradation of C3 and thereby preventing tissue damage. IgG therapy also neutralizes pathogenic autoantibodies via anti-idiotypic antibodies, specific antibodies that target other antibodies. Additionally, by binding to receptors on various immune cells, IgG therapy inhibits the activation and function of monocytes and macrophages, suppressing the production of their inflammatory mediators, prevents the differentiation of monocyte-derived dendritic cells, preventing the secretion of pro-inflammatory cytokines, modulates NK cell activity, reducing the activity of cytotoxic NK cells while increasing the activity of regulatory NK cells, and reduces the activity of autoreactive T and B cells, downregulating the production of inflammatory cytokines and pathogenic antibodies. As we have shown, IgG's multifaceted mechanism of action addresses multiple pathways involved in autoimmune conditions like CIDP and DM, thus reducing inflammation and tissue damage. This broad approach enhances the effectiveness of IgG in managing complex autoimmune disorders and exhibits immunomodulatory effects without the risk of immunosuppression or reductions in Ig or B cell levels, offering a strong safety profile, trusted tolerability, and high efficacy